What is the best way to avoid diarrhea and vomiting, stomach bugs, gastroenteritis, food and waterborne diseases while you're traveling?
So
what are your top tips?
my top tips are almost 40% of people who travel will get some diarrhea. The single most important thing is hand hygiene. So washing your hands with soap and water reduces your risk of getting diarrhea by up to 50%, depending on what data you look at. You obviously have control of your hand washing, less so on other people who are preparing your food. But what we would say is avoid ice, usually, because that's very rarely made from bottled water or filtered water. Buffets in places where the rice and the salad and things have been sitting out in the sun for days on end tend to be higher risk than somewhere that has a high turnover of well-cooked food. And try and get your children to wash their hands is what I would say.
Do you think, is it worth saying it's also not possible always to avoid D&V, especially if you're traveling to low and middle income countries?
Yes.
I would say you and I are careful travelers, or we're fairly expert travelers, and I have not been able to avoid it on every trip I've made.
Yeah, I think that is fair.
Particular pitfalls are like places where there isn't repeat custom, where they don't necessarily have a great investment in protecting you from food poisoning. So places where local people eat are often better than airport food or hotel food.
Yeah. And I think the other thing is thinking about the water that you are drinking, making sure you have enough of it if you're going somewhere more remote. And if you don't, that you have the facility to really make sure that it's clean. So if you boil it, make sure you can boil it for 5 minutes. And if you've got some sort of some either filtration system or something like, iodine or a chlorine tablet or whatever, if you're going very remote. And being aware, I think the other thing that people often don't realise is that the boiling point of water changes when you're at a higher altitude. And there are very clever apps that tell you how long you need to boil the water for if you're trying to climb up Everest.
And I have fallen foul of that, failing to boil water at high altitude and getting a parasitic infection called giardiasis, which is one of the very common things we see when we look after patients who've been traveling, who've come from abroad. It's one of the common causes of diarrhea. Yeah. We also now see it in UK wild swimmers and surfers.
Yeah.
It is also, you can get it from swimming in UK water.
And I go, one last point on here before moving on. If you're buying bottled water, make sure that the bottle is truly sealed and it hasn't been refilled by somebody and then they've just done the top back up, because often that's a way of making money.
You want to unclick the bottle yourself.
Yeah.